Hi, my name is Agnes and this is my review of week 12 and 13 of Achilles Tendon Rupture. I ruptured my Achilles tendon on June 8, 2016 and I decided to go a non-surgical route. So in the week 12 and 13 it was mostly about increasing PT, my physical therapy. I saw a doctor of the beginning of these 2 weeks for my checkup. It was a checkup after 1 month, so I was really curious how my tendon is doing. So the doctor was really happy with how it's healing. He was saying it's looking really strong and it doesn't look as thick as he's seen some patient going surgical route. So I was happy about it. So there was not that much scar tissue, I was told. Another thing was he performed Thompson test and finally my leg moved a little bit in plantar flexion, meaning my toes, after my calf was squeezed, my toes did move. So that's made me happy since we haven't seen it for the last 3 months. And another thing, I got ultrasound. I was told that there is no point doing it before 3 months, and even now on ultrasound there is a lot of uneven, unorganized collagen in there. That a tendon that is grown together does not, it looks really thick on the ultrasound, but it does look like one tendon is finally grown together. I'm not too surprised about it because I have been pretty active on my leg in the last week, so I know it's working. I can push off of that leg, so that's been progressing really well. But I was really glad to hear the doctor's assessment and him saying that he thinks it is looking pretty good at this stage. I was given an okay now, starting week 14, to do gentle stretches. Going non-op route, you really have to be careful about not stretching your injured leg too much in dorsiflexion position, meaning putting toes up. That stretches tendon and that can cause you to heal long. So now at 14 weeks I was given an okay to nothing aggressive, just something gentle, so my PT will be directing me with some stretches. My PT actually measured me and my both feet are the same in plantar flexion, meaning when I put my toes down, so my both feet are equal, so that's good. As far as dorsiflexion, my healthy left leg is at 18 and my injured right leg is at about 5-6 degrees. So this is, I guess, good indication that I didn't heal long, but that's something we'll be working on in PT. So the biggest difference in week 12 and 13 was basically working on walking, and I have separate videos I recorded during that time on my walking. So it's been really work in progress. It's getting better. I still am not walking on my without shoes. I'm wearing shoes in the house, outside of the house, and inside of the shoes I have gel pads. So that's just to show you. I got shoes that have slightly higher heel than toe, and I always have gel pads inside, so that gives me extra elevation on my injured foot. And I do wear a compression sock as much as possible. That really helps the swelling. I do not see much swelling, but when I don't wear it I do see some, so that definitely helps. In week 12 and 13 we also increase intensity of my PT. My physical therapist tried, just tested me to see if I can do single calf raises, since my double calf raises are doing pretty well. So basically, just to show you, this is my healthy leg, I can do easy single calf raises. On my injured right leg, when I tried, nothing. Basically it's so weak still that I can't do anything. I cannot lift off at all. This is still ahead of my schedule to do it, but we just tried it out. So to strengthen this calf, my PT put me on horizontal leg presses, and that's something that gave me nice indication of how much weaker that calf is. basically we can isolate this calf and work on left and right leg separately and increase weight. So this has been going pretty well in PT. Other than that, like all the exercises that I mentioned in my previous video and also on my blog are still continuing, and I have some new exercises we started in the last 2 weeks in the following videos. So I'll just try to show the difference in my calves. This is my healthy left calf, this is my injured one. So you can see the difference in muscle definition and also in the tendon thickness. Let me get slightly closer. So this is the healthy one. You can see nice definition and how thin it is. And this is my injured one. It's still very thick and there is no definition. It is strong, but it's still very thick. And all these marks, ignore them, that's just from my compression sock. So here it is again. I'll show you how I walk right now. I have to really concentrate to avoid the limp, otherwise, like in the evenings or when I'm tired, I do see bigger limp, but right now I'll be thinking about it, so it's going to look slightly better. So here it is. So as you can see, I can use both legs pretty evenly. My injured Achilles is a little bit tight right now, so my doctor told me that this is what causes the slight limp, but I'm supposed to start stretching it slightly now. I'm at 14 weeks, so he said it's safe, that it won't cause healing long. So here's again, I'm walking or learning how to walk. It might look easy, but I do think about every step still. So I'm going to show you how I do the stairs now. So I'm in a seated wall position, and I'm just moving my heels up and down. I find it works better if I don't do it on carpet but on hardwood floor, since my feet do slip on the carpet. So I initially started with single leg and then progressed to double. And this is the injured leg. And here's sideways for the toe raises. This is just the yellow band I was giving to enhance my balancing exercises. So I just put it on my both ankles. So this is it for my week 12 and 13 review. Basically, it's all about PT now and walking. Still can't walk uphill, still can't walk bare feet, but walking is getting better and better. As far as PT, I do it twice a day, and I'm being really diligent about it. So literally I get up first thing in the morning, I knock off my first session, and then before going to sleep I do my second session. And then during the day also, if I sit at the computer, I get tight, so I will do some calf raises or heel raise, seated heel raises, and I'm doing some bend ankle stretches, so that's also helping. So as much movement in that calf as possible, and just really being diligent about my PT. And the doctor is liking the results, and my physical therapist is liking the results, so I'll continue doing it, and I'll update in a couple of more weeks how is it going. So for everyone out there that is still healing, if you're in this journey, happy healing, and be diligent about it, and it does get much faster. Things passes by faster. You really are getting back to your normal life much faster in the later weeks. It's not like in the beginning when you're really getting used to the new situation and all the struggles with immobility. And if you're just watching it for information, hopefully the video is informative. Check out my blog as well, and happy healing.